COVID-19 deaths are reaching alarming levels, not only in the state, but in the entire country. The #1 killer of Utahns is heart disease here in the state. But last week, COVID-19 deaths matched the average weekly deaths from heart disease in Utah from 2019 data.
It is alarming. And with Thanksgiving and its family gatherings this week, Fox 13's Diego Romo spoke with a doctor from Intermountain Healthcare about what we can expect in the weeks to come.
77 people died from COVID-19 in Utah last week, which is equal to the average weekly deaths from Utah's leading killer in 2019. Doctors warn that deaths could continue to climb if something isn't done soon.
What we're just seeing is the natural proportionate increase in deaths because we have a proportionate increase in cases.
Dr. Vento said the COVID-19 death rate isn't increasing, but because we have more cases, we in turn have more deaths.
That's because we've just had more cases, therefore more hospitalizations, therefore more deaths.
Deaths could keep climbing if hospitals around the state continue to have an influx of patients, a grim situation seen in New York City and other places early on in the pandemic.
The case fatality ratio actually climbed because they had less of an ability to keep people alive with COVID because they were stretched thin on resources.
Last week's death total matched the leading cause of death for all Utahns last year. On average, 77 people died of heart disease every week in Utah in 2019. The total surpasses other leading killers like cancer, the second leading cause of death at 64 per week, and strokes at 18 per week, which was the state's fifth leading cause of death. Thanks to the work from hospital staff,
our case fatality ratio for Utah has actually stayed fairly low compared to many other places for the past 10 months, and we want to keep it that way.
In order to achieve that, he is asking Utahns to take public health orders seriously.
But we need help. We need folks to not get COVID. Therefore, they have to really take those measures to heart. And don't gather and wear a mask all the time and do your social distancing because that's what's going to stop the increased number of deaths.
With Thanksgiving just days away, he says the biggest thanks you can give healthcare workers is to follow those guidelines.
Do the measures, take the measures to stop the deaths and the hospitalizations and the suffering. And that's all we want. That's thanks enough. Just, do your job.
With daily cases in the 3,000s for much of last week, Dr. Vento says we can expect more hospitalizations and more deaths in the coming weeks. In Salt Lake City, Diego Romo, Fox 13 News, Utah.